Risk and Scrutiny Committee. Thank you, that's the recording just started now. Welcome everyone. In terms of apologies this morning, I have apologies from Karen, and Paul Ryan is covering Karen's position. So thank you for covering Paul. I think everyone knows Paul quite well because you have sat into the Renfrewshire IGB a number of times, and I suppose what we have just tried to do, so we've got that continuity of knowledge, so it's really good. Thank you for coming this morning, Paul. I don't think we have any other apologies. And a couple of people have intimated that they might need to leave just before the end, and that's fine. You can just drop off if needed. So thank you for flagging those. Are there any declarations of interest in terms of the items in today's agenda or transparency statements to make? See a few shakes of the head, so thank you for that. I'll assume no, so thank you. We'll just crack on. So item 1 is the minute of our previous meeting, which was the meeting back on the 14th of March. Do we have any comments or questions on the detail of that, or are we content to approve? See a couple of nods. Content to approve. Thank you for that. Let's take that as approval. That takes us on to the item 2, which is the unaudited annual governance statement. And Sarah, I will come to you on that one.
Okay, I won't go through it in detail because it's quite a lengthy paper and there are quite a lot of papers on today. But this is here today and requesting approval so it can be included in the annual accounts, which will then be submitted to the IGB, the unaudited accounts, next Friday for their approval to submit to audit. There's a couple of things I just want to highlight, and that is on page 14 of the papers that you have in front of you, just to highlight that we referenced the local code of corporate governance, which was previously, and the one that relates to this governance statement, audited this time last year, and the update is actually paper 7 for 2025 as well. So it's part of a cycle of regular updates that are brought to the audit committee. And then also on page 19, just further information about the self-assessment and the insurance work that is done behind the scenes by the senior management team for both NHS side of the house and also the council processes. So it's quite a rigorous amount of review that we do to ensure that we're following all internal controls appropriately. And then also on that page, you'll see the internal audit opinion and the certification from internal audit as well. So it's important to note that we work very closely with internal audit, and obviously Karen's team have had sight of this and are fine with the content of it. So happy to take any questions, but that's all I was proposing to say today.
Thanks, Sarah. I think, Sarah, I had, following our pre-agenda, I had shared some comments. I don't think those were picked up in this version, so I don't know if that's just a version thing, but I know you had picked them up at the time. And there's one other wee tiny thing, and again, it just proves I do read all your papers. See on page 21 of the pack, it's in the box at the bottom, the very last paragraph. It, as noted above, the IGB has approved further 13.8. I think we need million in there of savings.
That's fine. I can update that. I thought we had picked up all your changes, Mags. I'll check through to make sure that they have been reflected in the one that's going through to the accounts. I thought we had. So we'll double check that to see what's missing.
I couldn't see any changes. I mean, just for the benefit of everyone on the call, there wasn't anything substantive. It was just tiny wee suggestions about clarifying interim chief officer and the non-executive directors from the health board, given we obviously have a member who is an executive director but is a board member. So I was just clarifying that it would be more accurate to describe the membership as health board members. So it was really minor wordings that I'm happy for Sarah and the team to take away, and there's there's nothing substantive in my comments to bring out here. My reading of this is that it really gives a good overview of our governance. Obviously, it's subject to external audit as well, but I know Grace is on the call. Have the audit team been involved, Sarah, in discussing this with you at this draft stage as well?
No, the external audit team are not involved at this stage with the governance statement because it's about internal audit processes, internal processes. So they will look at this as part of the overall review of the unaudited accounts.
Yeah.
But we definitely have made the adjustments in the one that's going in the accounts. So that's obviously a timing issue when the papers went out. So the adjustments have been made in the other one. I've just checked. So apologies for that.
Oh no, that's fine. It's always quite a quick turnaround with papers at this time of year. And that then feeds into the papers that we'll see for the IGB next week. Is that right?
Yes, that's correct.
Super. I don't see any other hands or comments up. So we are approving this morning. And obviously there have been minor tweaks in the one that goes forward, but in essence, the governance statement stands. So we're content to approve that this morning. Thank you. I see nods. Thanks, everyone. That then takes us on to the detail of internal audit reports. So there's a few on the agenda this morning. So I'll hand over, morning Karen, hand over to you for item.
Morning, everyone. The first paper is just giving you an update on the audit plan progress. Basically, we've finished the plan for 2024-25 and all the training briefings that were planned have now been completed, and we've got arrangements in hand to prepare a new training briefing programme, which we'll agree. I have asked for knowledge and skill frameworks to be completed, and that should feed into the training plan. I'll just carry on with.
I don't think there's any questions on the progress. As always, it's just helpful to know that there's work going on in the background and to give us assurance that that work is continuing through the year. So take nods as agreement, and we're just noting that progress this morning. So yes, please, that takes us on to item 4.
And this is just giving you details of the audit activity and partner organisations, i.e. Renfrewshire Council and Greater Glasgow and Clyde Health Board. 4 audits have been completed in the Health Board side and 1 in Greater Glasgow. Just a couple of points for noting. The risk management review was undertaken by an external consultant, but that's because the Council's risk management team is part of internal audit, so we bring somebody else in to undertake that. And the enterprise resource planning system review was a bit different from the normal assurance review that we undertake. It was more just to understand where we are with self-serving within the council, and also what issues managers and supervisors were facing to enable the self-service to go ahead.
Thanks, Karen. Again, with all of these actions rest within the respective audit committees to follow through and understand what action's been taken and timely follow-up within the council and the health board. So again, this is just oversight of anything that would particularly impact us and of interest, I guess, to both yourself as internal audit and external audit, if there was anything that affects the accounts, which I don't think there is. Any questions on that update this morning? No, you're getting off easily this morning, Karen. No questions on that. So thank you for that. That takes us on to item 5, because we're just noting those updates. Item 5, please.
CIPFA, the professional accountancy body for the public sector, brought out a new code of practice for the governance of internal audit, which is to be implemented. It came out and implementation started from 1st of April, but they have given us a year to get it fully implemented. So what I have done is I've undertaken a self-assessment of how we operate against the guidance, and I've enclosed the that self-assessment in the Appendix 1. So as you can see, in the main we do comply, but I have got an action plan of the actions that I need to take forward during the year, in order that we fully comply with the guidance.
And in terms of those actions, any concerns from you, Karen, in terms of being able to do those in the timescales?
No, we will get them done. I've actually finished the self-assessment of the Global Internal Audit Standards, and I will bring that to the next board if there's any further actions. But yeah, and we'll update the charter for the next board as well.
And when you say next, you mean the next meeting of this committee?
Yes.
That will come through the cycle. Yeah. So that was my next question, just around the updates and that. So we'll see that through this year's cycle, isn't it? The 25-26 cycle that we're in at the moment. Any questions on that? Alan, bring you in. Morning, Alan.
Thanks, Margaret. No, it was really just a comment. I think I actually thought this was a really excellent way of producing the report, whether that was established by CIPFA in terms of the appendix, but essentially I think the way it's laid out really gives real clarity. When you're not a audit person, which obviously clearly I'm not, there's a degree of just having that in black and white with some really key sort of timescales attached is really useful. So it's just to say thanks and noted. Thank you.
Thank you.
Thanks, Alan. It helps us to keep us up to date, which is helpful. Jacqueline, bring you next.
Thanks, Max. Yeah, similar comment to Alan. It's a good reminder of our responsibilities and roles, and just to go over that again. The bit I was going to ask about was about feedback on performance evaluation and job description. Is that something new, Karen? Because I don't recall being asked that before as chair.
Yes, it's part of the new standards that have come out as well, Councillor Cameron. Yes, it is new, and basically we'll need to think about that when that is happening.
Yeah, I suppose it just struck me, Mags, as councillors, we're always a bit obsessed with strategic and operational, and obviously we're just feeding back. We're not writing the job description or writing the performance evaluation, but it just seemed a wee bit different from our normal role. But obviously, I think if everyone else is comfortable with that's absolutely fine. But as I say, we do focus a lot on not delving into operational things, so it felt just a little different.
Okay, it was council practice to ask the chair of the council board, so there is a forum that can be easily distributed. That's already in place, and I'll remind the Director of Finance of that at my next management meeting, that has to take place for this board as well.
Thanks, Karen. Thank you.
I think that's a good observation, Jacqueline, because it is slightly different in our relationship as audit committee members in the generic sense. So this committee for this IGB, we are supposed to have we do have a direct relationship with internal audit that's intended to bypass in some ways management if need be. In all practical sense, you wouldn't want to do that, but if there was something, I guess I'm not suggesting it's the same, but it's I guess a sort of corporate whistleblowing route to us should there be some control breakdown. External audit should have that relationship as well if they feel there is something so important that they would need to bypass management structures, that there is a more direct relationship with audit than, well, it just doesn't exist for other parts of the organisation. So I guess this is drawing that difference out a bit more clearly as well. You would hope, and we have not been in the situation that you would actually need to draw on that, because the management structures are there for employment purpose and all the rest to make sure that Karen sits within the council structure, and that's needed for all sorts of other reasons in terms of our employment. But if there was something critical, there's a link to us. A wee
Thanks,
quirk.
Max.
Quirk. Just more responsibility, Jacqueline. But thank you, Karen. That's obviously been well received by the committee this morning, and a helpful layout in terms of your work and how you're addressing it. So thank you for that. So we're just noting that this morning, and we'll see updates coming through in coming committees. That takes us on to your last report, item 6.
Yes, this is our annual internal audit report for the year for the IGB. It contains details of the work that we've carried out within the IGB and also by my team in the council and colleagues of the NHS internal audit team in the health board. It also gives details of our performance. The main area to draw your attention to is section 6 on page 67, which is the annual assurance statement from internal audit, and that supports, as Sarah's already said, the governance statement, which we addressed in item 2. I'm pleased to say that we've been able to conclude that the internal control, risk management and government arrangements in place are satisfactory. And finally, just to give you a quick update on my team. As you know, since Andrea, the previous internal audit, retired, it's been an interim position because an option appraisal exercise was ongoing to determine if it would be beneficial to have a shared services option for internal audit with other local authorities, but that's not going to be taken forward, and there is arrangements being made to recruit a permanent chief auditor into the post. That's all I had to say.
So I guess the key message for us this morning is that effectively a clean opinion, so reasonable assurance, which all of that feeds back into the item, our governance statement that we are approving for the board. And I made the comment at pre-agenda as well. It's there's a lot of detail in your annual report there in terms of changes, but actually for us that's really helpful to see, because otherwise, unless we sit on the council equivalent, we wouldn't have that understanding of the details. So it's helpful to be brought up to date with changes in your team. Don't see any comments or questions, so thank you for all the work this year, Can, because it gets us to the position where we're able to get the accounts through the board meeting next week and then ready for audit. So thank you for all that.
Thank you.
We don't approve that, we're just noting that this morning because it is your report, so thank you for that. Okay. That takes us on to item 7. So it's local code and sources of assurance for governance. And David, morning, David.
Yeah, morning, Margaret. So this report was referenced by Sarah earlier, and it's brought to the committee every year, and it sets out the reviewed local code and sources of assurance for governance arrangements, which the committee's asked to review and approve today. So the local code itself is the statement of policies and procedures through which the IGB's functions are directed and controlled. And we review this every year to ensure that any changes that have happened over the course of the year are reflected where necessary. It also sets out the sources of assurance that help IGB members to continually assess their governance arrangements. And these are set out in Appendix 1 to the paper, aligned with each principle of the code itself. The paper also goes on to highlight some of the key governance changes that have been made in recent years, which are included in the appendix. And it also notes that some refinements have been made to reflect terminology changes over the last 12 months as well. We also reflect that the local code has been subject to internal audit in the last year, which it is every year, and there were no recommendations from that internal audit. However, should any arise from future audits, then they'll be taken forward by the HSEP's senior management team, and we would report progress back to the committee on those as well. That's all I wanted to cover on this paper, but very happy to take any questions.
Thanks, David. Again, this is one of these ones where it's really helpful and a bit of a reminder of the breadth of activity that underpins all of the work that goes on. None of this should really be a surprise to anyone on the call, but it's always really helpful that it's brought together in one place like this, that we can genuinely take assurance from it. So we are being asked to approve this morning. I'm sure everyone has read it and recognised most of it as they go through it. I don't see any questions or comments on it. Again, just thanks. I find it really helpful, David, just to run through any updates in the year. So with no questions, I take it members are content to approve. Okay, thank you. So that is approved this morning, David, thank you. And still with you in terms of item 8 on the risks and issues register.
Yes, thanks, Margaret. So This report highlights that no new risks have been added to the register in the recent period. Also, the scores of our existing risks and issues have also been maintained at the same level, and we have 6 risks and 2 existing issues that are at the highest rating available, and they have been for some time. And those risks and issues are all predominantly linked to financial and workforce challenges. We've also described where we've updated the commentary for our risks and issues where appropriate, and that's in section 4.6 of the paper. The most material change to the register is the addition of a further issue, which is issue 3, and it focuses on the constraints that we're experiencing within the HSEP in terms of the capacity we've got available to deliver the scale of activity required within sustainable futures, also alongside forthcoming transformational activity from our partner organisations, and that's whilst continuing to deliver operational services to the highest quality that we can do. That issue also extends, and we've noted that it extends to constraints being faced by staff side and trade union colleagues, which has limited their ability to engage with the breadth and scale of the work currently underway. As part of mitigation for that, we do continue to prioritise our activity as far as possible, but there are limitations to what we can prioritise, as a lot of the work that we are taking forward at the moment is absolutely essential commitments, particularly around that savings work that we're all familiar with. So I'll just kind of pause there, but I'm happy to take any questions.
Thanks, David. There's a lot in that paper. A couple of hands up. I'll come to Lisa Marie first. Thank you.
Thanks, Mags. It's not a comment, it's a question, and it's the same question I made it pre-agenda, but I think I should make it publicly as well. I'm aware that we are due to do an update of the risk register, and I had just reflected that there are some risks that sit in our risk register at different levels to what they sit in the partner organisations, and part of that may be that we don't really hold the risk there, but cyber is an example for council. That's a very high strategic risk, and I'm sure it's probably similar for NHS, and while I don't think everything has to perfectly match, I do think when we're doing that work it's important to look at where we can match the language and those sorts of things, and also look at where our risks are sitting and how our partners have assessed them, just to see if there's anything that we can pick up so that we're aligned where we can be. So yeah, I know that work's due to happen, and I spoke to David about it already, but I think it's important that people know we're looking at these things, so I thought I would raise it here again.
Yeah, David, are you able to share with committee just in terms of how that work is progressing? Thank you.
Absolutely. So we're scheduled to pick up a review of the risk framework again in the second half of this year to bring back to the committee at its first meeting next year. We do continue on a kind of week by week, month by month basis to work with the partners in NHS, GGC and Renfrewshire Council through risk management governance, just to look at where we can bring consistency as far as possible. I think everybody will be aware that there is differences in the risk management approaches. So we do sometimes have to look at those different approaches and select which is most appropriate for the IJB and the HSEP on a case-by-case basis. But we certainly do look to try and bring as much consistency as we can do so that we are aligned across the 3 organisations where possible, and we'll continue to do that over the next review that will start in the second half of this year.
Yeah, thanks for that. I think the key thing is probably where we have common risks, if there are lots that are common. There are some that don't impact the partnership, I guess, in either organisation, but where there are common risks, you would expect them to be graded or responded to in a very similar way. And I guess that's what we're just seeking, that there's that consistency of emphasis on where risks sit, which sounds like we are looking at. Jacqueline, come to you next.
Thanks, Mags. Yeah, I just wanted to voice my support for the additional issue around sustainable futures. I think it's really important that we point out to people that, you know, staff are under, you know, certain constraints, not just in terms of workload and capacity, but just in terms of the nature of sustainable futures. I attended a couple of consultation sessions this week online, and, you know, staff are doing a brilliant job, but obviously it's a difficult task. And I just wanted to acknowledge that the extra work they're putting in, and that, you know, as a committee and as an IJB, we appreciate that. So was glad to see that added to the register. Thanks.
Thanks, Jacqueline. That's appreciated.
I agree. I think it is something that we've talked about as a real concern at IGB level. So I think you're absolutely right. It's good that we've properly documented it, because the workload is huge around sustainable futures, and none of that work takes away from day-to-day roles. So it is, we have limited resource in every sense. So it is a real issue for us. In terms of this paper, it does, there's a lot of detail in there. Again, how I tend to look at the risks is, do I recognise how they're described? Do I recognise the actions? And it does go into a lot of detail around the things that we're talking about month to month and that we see coming through the IGB. So I think it does certainly reflect the high risk environment that we're in at the moment. So we're being asked to approve the update to the risk register this morning. So given the questions and comments, take it from that, the committee is content to approve the update in the risk register. Thank you. Thanks, David. That takes us to item 9, and we've got the inspection of Renfrew Care Home. So can I welcome Kerry this morning? Trying to see you on my screen. Morning, Kerry. Morning. Well, you're covering this item for us. Now, everyone will have read the paper, but if you want to just draw out the key messages this morning, that would be really helpful.
Yeah, no problem. So there was an unannounced inspection at Renfrew Care Home conducted by the Care Inspectorate on the 7th and 9th of March. This was evaluated on 6 key questions: supporting people's wellbeing, leadership, staff team, settings, care and support. The inspection identified 1 requirement and 3 areas for improvement. With the current redesign of the care homes going from 3 to 2 care homes, both residents and staff have needed some embedding into the new workplace and the new care home. So this could be reflective in the current grades that we've been given. The Care Inspectorate used different methods for the evaluation. They spoke to clients themselves, families. They also got review feedback, they spoke to staffing, and they also observed practice. So there was a lot of key strengths that came out of this inspection report. It was a welcome environment, there was positive relationships between resident staff and their management, there was infection control and was respectful around personal care. Management were approachable, responsive, and demonstrated a clear understanding of the needs. There was some areas that were highlighted for improvement. They were looking for more meaningful activities, enhancement in training for staff in dementia care around stress and distress behaviour, improved personal care plans to reflect up-to-date information, and staff arrangement to reduce the reliance on agency staff. So we have put together an action plan that has been submitted to the Care Inspectorate, and they're accepting of this action plan. So some of the action that we've taken already is we're looking to do the recruitment process for permanent staff to reduce the reliance on agency staff. So a lot of these have been advertised and they're now going through the recruitment process. We are still using agency staff, however, we're block booking the staff so that we get consistency for residents and the care home. And we've had some positive stuff coming back from the staff that are agency that are looking to apply for the permanent post. So again, that will have consistency without the care home. We've implemented a new dependency tool, which will better assess the residents' needs. And we've got an introduction of an outcome-focused care plan and meaningful activities. We're getting all that up to date. And there's planned training for dementia for staff within the homes through our care home collaborative team. We also made sure that the Renfrew Care Home was inspected before Hunter Hill Care Home. So we made sure that the learning we had from Renfrew Care Home, we already started that implementation in Hunter Hill. Hunter Hill has now been inspected and you'll receive that report in a few weeks' time. But we're making sure that the learning from both inspections being implemented in both care homes so that we can improve the grades for going forward. Everything that's been put forward is very much achievable by the care home, and there's nothing that we don't think that we'll be able to achieve. Care Inspector come back in the 30th of June, and we're already making progress with the action plan that's been put forward. That was a quick summary, but I can take any questions if there's any questions.
Thanks, Kerry. That was really helpful. Just a really concise summary of everything. So the key thing is we're going to have another visit at the end of the month, which is just just over a week away. And I guess what we'll hopefully see is those improvements coming through in the Hunter Hill inspection as well. So a couple of questions. Lisa Marie, first to you.
Thanks, Mags. And I suppose I'm asking for anecdotal answers to these questions just now because they've not been re-inspected. First, I want to say there's lots of positive here. And I mean, with a different hat on, I'm a Renfrew councillor, and you can walk to the care home from my house in less than 2 minutes. So I know the community well, and people find it a very nice place to live, which I think isn't always brought out when we have these inspections. Nonetheless, there are things that are issues. So the two that I guess I would have picked up straight away were the assessments of people's care and support needs and improved management of medications. Those are really crucial things in terms of people's support, and I wondered where we were on that, Kerry.
So I had met with the manager of the care home last week, and they are going through every person's care plan to make sure that they're now up to date with all the correct information, and they are on target to have all that completed by when the care inspector come back in at the end of the month. They've also looked at training as well for staff to make sure that we're all up to date with medication training as well.
Okay, that's really helpful. Thank you.
Thanks, Lisa Marie. Jacqueline.
Yeah, I just wanted to say, Mags, that I know the care inspectorate grades aren't an exact science, but given that there were a lot of positive comments, in some ways I felt like the grades and the comments weren't really matching. I mean, I wouldn't argue with it, because obviously there were issues that they'd identified, and obviously, Kerry, you're working on that action plan. But yeah, I was looking at the two and thinking, do they match? But as I say, it's not always an exact science with the care inspectorate. The other thing I wanted to say, and I know that you're working hard on this, Kerry, is that we really need to get this right, because the decision that we made as an IJB to close a care home was not an easy one for any of us. So we really need to get it right for the residents that have had to move. So, and I know you know that, but I just think it's important to say that out loud. So thank you.
No, thanks for that, Jacqueline. And the care home and the managers are very much aware of that, and that's their aim, to get all the bedding in. Of everybody's now moved, all the staff are all now moved, so it's now trying to get all that kind of evened out so that we can absolutely improve on the grades that we've been given.
No, thanks. I think that's a point well made, Jacqueline. Paul, I see your hands up, but Karen, did you want to come in on this point before I bring Paul in?
Yeah, it was just to reassure everyone around in the meeting that staff are working really hard to make sure that process of change, because it has been, and we were absolutely consciously aware, the significant change of people moving into the care home, new staff moving into the care home, and that level of initial impact that would have. It's unfortunate that our care inspector chose to come in at a time when we were just really bedding in those changes and those staff changes, and just trying to reassure our residents who had moved, and for those people who were living there for the new move as well. And I take the point that Jacqueline made around that kind of reflection of grades not sometimes matching the kind of the wording of the inspection, and we have pushed back in a number of inspections, because we know, and it's not just ourselves but across the country, we're looking at reduced grades from the care inspectorate. So there has been a national pushback to say, look, can we have another think about inspection? Is the narrative and the grades similar? So we've had ongoing discussion with our lead inspector, but also the inspection team who were out into both of our care homes, just to say, can we chat about some of this? So we'll continue that discussion going forward. But as I said, it was, the timing, it would have been nice to have a bit more time to embed some of that changes before our care inspector come out. But that's just the nature of that scrutiny, and it's right and proper to have that external scrutiny in place, just to ensure that we are having the highest level of care for our service users. But just by way of reassurance, we are seeing really positive improvements going forward.
Thanks, Karen. That's helpful. Paul, thanks for waiting. I'll bring you in.
A question, this might show my ignorance. Is it normal for the care inspector to go back in quite a short space of time? They normally visit quite as quickly as that?
Yeah, that's their process. So if there's a requirement that's been made, they normally come back in within quite a short period of time, to even not necessarily that you've met the requirement, but that you're making progress in meeting the requirement. So they do come back in, and then at that they'll then review, and then they'll decide when they're coming back in again. But yeah, they do normally come in quite in a short period of time, especially if there's been a requirement put forward.
Thanks.
Just to clarify, Kerry, do we get a formal report following that 30th of June revisit?
Yeah, they give feedback to the care home manager. Yeah.
So, but is that something that will? I guess my question is thinking: does it filter its way through this committee if it's formal reporting, or do they wait till a period later before they formally report?
No, you get a report. Get a report.
Right. Okay, so we'll pick that up again, so we'll see that progress. Thanks very much, Kerry. That was a helpful run through, and it gives us a sense of what's actually happening in quite a short space of time, actually, which is really helpful. Thank you.
Okay, thank you.
That takes us on to item 10. Pauline, I'm coming to you for this item in terms of the joint inspection.
Yes, you are. So this paper is around the joint inspection for adult support and protection in Renfrewshire, which was concluded towards the beginning of the year. I think we got the report end of February, beginning of March, and I'm very aware that most people have seen this and have been in many meetings. But from a governance point of view, I think it's really important that we bring it to Audit, Risk and Scrutiny. So I won't take a huge amount of time. It's a really positive report, and I think it's fair to say that the officers and everybody involved were really quite delighted around the findings. It was an inspection that carried on from one that was paused in 2020 just as the pandemic hit. So it was a full inspection, but it was proportionate in relation to that had already been started in March 2020. As I said, it was positive, and with respect that Renfrewshire was only one of 2 areas in Scotland to achieve 2 very effective progress statements, and that was around our adult support and protection processes, which were found to be really sound and effective. And they notice our commitments to being prompt and competent and requiring in response to our inquiries, and also around the strategic leadership, and that was really demonstrated again to be highly effective. And I think that was really heartening for all of us around this virtual meeting, around that strategic leadership as well as the operational leadership to our staff. As you would expect, there was some areas of improvement. I think certainly the areas that were brought forward we were very well aware of and already had started work on them, but that was the joint inspection had noted them, and that was around the quality of the chronologies and risk assessments, and work, as I said, had already started but is continuing, and we're trying to do that in a very joint way with our child protection. So we're doing that as a public forum, a public protection forum rather than individuals. And the other things that were picked up were around facilitating adult participation in case conferences and improving the representation. A more challenging ask. I'm not sure if I've dropped out, so I hope I'm back.
I thought it was just me. You went silent for a wee second. I think it's just like a sentence we missed there, Pauline.
So it was about facilitating adults' participation in case conferences and having that adult voice of lived experience strategically in our public protection forums, and that's the 3 areas really of the recommendations we would be looking to make some improvements in. But all in all, it was a really positive report, and gave us some really positive feedback on how we're moving with public protection, and obviously the aim is to continue with that work.
Thanks, Pauline. And you're right, we have talked about this quite a lot, but this is really for completeness, just with the timing, so that we've made the decision all these types of external inspection reports come through this committee, so that we do have that formal record of it coming through. I'll go to questions. So Alan, come to you first.
Thanks, Max. It was a great report, obviously, and so good to see such a positive inspection. I suppose from my perspective, it's the range of partners that are involved there and how that. I would imagine if there was a critical element, there is obviously some expectation in terms of changes, but how that's then shared with the partners within the delivery, just both the success and the kind of aspect of what needs to happen next. At this time, I think we're all feeling it. If there's a good news story, it'd be great to hear it, I suppose, particularly if it's partnership delivery, and quite clearly here there is a strong partnership. And Pauline, I just wonder whether that was something we were sort of trying to make sure was communicated to everybody who'd been involved in the delivery.
Absolutely. I think we were clear in our delivery back to the staff and the feedback to the staff, who obviously at the front.
Oh, Pauline, we've lost you again there.
In relation to the improvement work, the subcommittees that attach to public protection are led by other partners. So it's a very whole system approach, and I think we are looking very closely at opportunities to jointly train, not just across health and social care, but including our fire services, our third sector, our police services, and looking at how we can do things jointly. And one of the key elements that was really brought in around the improvement of that, particularly around training, which has to underpin everything, was the drop-in sessions that had been started during the inspection, and we've carried them on, and we're getting over 100 staff members attending these sessions, and it's every month, adult and children. So it's created a bit of energy, I think, in the room within that. So I think that's what we want to hold on to and keep going.
Thanks for that, Pauline.
Thanks, Alan. Jacqueline.
Thanks, Max. Yeah, as Pauline says, I think I've seen this report about 4 times in different boards, Pauline, but I'll just say the same as I said again. Well done to everyone. It's a really excellent report and a gold star for Renfrewshire in that. The member officer group, we get a report on Adult Protection Committee and Child Protection Committee every few months, and we get a bit more detail there, so that's always useful as well. But yeah, just a well done to everyone, to all the staff concerned.
Thanks.
Thanks, everyone. Thanks for the comments. So thank you for that, Pauline. Some positive energy. That's nice to hear, actually. We all need as much of that as we can. So we're just noting that report this morning. But staying with you for item 11, for the first part of the Staffing Act.
Yeah, I'll try and keep the energy high. So I've got the first paper around Healthcare Staffing Act, again for noting. So there's a paper in relation to the health report, and then Thomas will follow on with the social care element of it. It's quite a lengthy paper, and I suppose it's lengthy just because it's a first report that we've done in relation to our compliance around the Healthcare Staff in Scotland Act 2019, where the reporting required to be done from a health perspective from the 30th of April. So this is the Renfrewshire part of that. So members will see that I've added the information around Greater Glasgow and Clyde from a health perspective, as well as the Renfrewshire, and it kind of outlines how we've implemented the Healthcare Staffing Act across the services, and where we've got some additional learning to do and some additional embedding into that. So what we've got, you'll see there's lots of tables with lots of colours in there in relation to how we've assessed our assurance and what each part, each level of insurance means. And for some that we have got substantial assurance, we're absolutely clear, and as we move through the duties of the Act, we've got systems and processes well embedded into the services, and we're clear in that. And for others, we are still embedding the standard operating procedures into the services. And for things like safe staff, risk escalation, and real-time staffing assessments, we require an electronic solution, and that's not yet in place. So it's reasonable insurance until that comes into place across the board level, and we're just using huddles and reporting mechanisms as a way to mitigate that. So there's with each I think we've got reasonable assurance in some areas due to that incompletion of those standard operating procedures and ongoing local testing, and we've got some substantial assurance in other areas as well that you can see. It's quite a challenging pull together for this report, so that the reporting of it in itself is being looked at about how we are pulling that data, so we know that the evidence is really robust, because we do expect Health Improvement Scotland to come and look at our evidence as we move forward with this to provide a deeper level of assurance. But we have an ongoing implementation group within the partnership, and we're all working together to make this as easy and as slick as possible. And you'll see from the amount of duties from health that comes in, about 13 duties that we're reporting on, and that's each service reporting on all of them, apart from the common staffing tools, because it's only nursing, children and families nursing, mental health nursing and district nursing that complete those tools at the moment, but that will increase as time moves forward. And one of the other things that I wanted to just pick out is in relation to the tools, there is some risk mitigation around what the tools are telling us, and the triangulation of using those tools. It is quite a complex process, and there is some disparities of what the tool run tells us versus the financial envelope that we've got to be able to provide the staffing within different services. So there is a disparity there, and that's noted within the report as well, and noted within the Greater Glasgow and Clyde report for the same reason. Happy to take any questions, and I do apologise for the weightiness of it. Hopefully we'll get that a bit more tighter as we move forward, and we're continued to report quarterly.
Thanks, Pauline. It is a tricky report in terms of having to pull that together, but it does show the complexity of our staff mix and models, and just the complexity of the services that we deliver, particularly when you take this paper with the next paper as well, in terms of those different systems that we're trying to integrate. So I'll come to Paul first.
Just a comment. I think it's a good report, actually, and it does provide the assurance you need. I think it would be fair to say everyone, including the Scottish Government, is on a learning curve just now. I say no one's quite sure because the dashboard's not there. So I think that's good. That's a good assurance on your report. So well done.
Thanks.
Thanks, Paul. I think that's fair. I think it shows, it does give assurance, because there are lots of comments about staffing made and all the rest, but actually this is evidence-based of how we are resourcing services, which is really good to see in detail. Thanks for that, Pauline. We're just noting that because this is going through the respective governance structures in each of the organisations for this and the next item. So come to you, Thomas. Good morning, Thomas, for item 11.
Thanks, Margaret. Yeah, so slightly less weighty paper than Pauline's, but still nonetheless fairly complex. I'll just pick out some of the key points and then take any questions that members may have. So under section 3.2 of the Act, when we are as an integration authority or a local authority planning or securing care services, we're required to give regard to listed items. And the reason that this paper's been brought here today is we've also got a duty under 3.6 of the Act to submit an annual report to the Scottish Government. That's due at the end of this month, hence the thinking of bringing the paper here for sight and comment before it does go. So I guess for members' awareness, we've been, as a contracts and commissioning team, working with colleagues across Greater Glasgow and Clyde and beyond, as well as COSLA and the Care Inspectorate, to really understand what the requirements are in relation to planning and securing services. An interesting comment there from Paul in terms of the learning curve. I think we're in a very similar position in terms of this particular part of the Act. So we got as much clarity as we could in terms of what was required, and you'll see in Appendix 1 what our proposed final report will be. I won't go through all the points in Appendix 1. In terms of the areas that we need to cover, it's contracts that have been awarded within the reporting period, which is 24-25. It's only contracts which have been awarded in that period and that are registered with the Care Inspectorate. So actually for us that boiled down to one framework, which was the flexible framework for supported living and community-based supports. That was awarded in November of last year to 23 providers. So I mean, it is one of the largest frameworks that we operate under. So we sought to then give assurances in terms of how we give regard to the Act with that one specific piece of procurement. What we done then was looked at the actual procurement process in and of itself. So in terms of the minimum requirements that we set for providers when applying to go into a framework, in terms of the service specification that we drafted, and all through both of those parts, there's very sort of key clear references to staffing and what the requirements we place upon third parties are in relation to that. We spoke a bit about the technical evaluation and how we evaluated those providers and their ability to provide a quality level of service, but also to be mindful of the Health and Care Staffing Act in that. We included a very specific reference and a narrative around about the Health and Care Staffing Act and the specification which feeds into the contract. Moving on from the actual procurement part of it, we've got a really robust contract management process in Renfrewshire, which gives us a good level of assurance around about providers' compliance with the Health and Care Staffing Act. I've went into some of the detail there and included what we would have as contract monitoring templates just for members' information. We finished with a couple, specifically asked by the Scottish Government to provide any risks that we feel may impact on our ability to comply with the Act moving forward. So we've drawn out obvious ones in terms of the financial pressures that we're all aware of, and actually the recent UK government white paper round about immigration control and the impact that can have on, we've got multiple commissioned providers within Renfrewshire who rely solely on overseas labour and the impact of that. So we've called that out. Overall, I think we've got a substantial level of assurance in terms of our compliance with this part of the Act. Happy to take any questions.
Thanks, Thomas. I don't see any questions. I guess I think for me it was just interesting just to see how the Act we've had to respond in terms of different parts of our services. It's quite helpful to see that around that commissioned piece there. Don't see any questions for you this morning. Thank you for taking us through that. So we are just noting. Oh no, Alan wants to come in. Sorry, Alan.
Thanks, Mike. Sorry, it's a kind of a bit of a late one, and I think it's a really impressive piece of work. Obviously, it gives the sort of depth required for people to gain contracts, and this is less audit and maybe just a sort of query to Thomas in terms of, you know, obviously third sector providers, for example, you know, how onerous this might be or how they react to that. We know third sector are providing services within health and social care. And again, I put it out more as a question to yourself, Thomas. Is there more we need to do to make sure there's a sort of more of an opportunity to draw other providers from the sector or other sectors potentially? But obviously I'm being selfish and thinking about the third sector here. So it's whether or not we can think about, you know, maybe some work around that, or does work around that happen to help encourage those providers who maybe are more community based?
Yeah, thanks, Alan. So I mean, first of all, it's specifically this part of the Act in relation to providers that are registered with the Care Inspectorate. So that's not all our third sector contracted providers. We've got multiple who don't fall within the scope of the Act. So there's no impact on them. For the ones who do, I would say we've the systems that we already had in place in terms of tendering, in terms of evaluation of tenders, and in terms of contract management gave us a really good level of assurance round about staffing and everything that falls within the Act. We've not required to make any significant changes, and I think if you were a third sector provider or an independent sector provider, you possibly wouldn't have felt a lot of difference in engaging with Renfrewshire round about this part of the Act. But happy to talk offline if you think there's anything else we need to think about.
Thanks, Thomas. I've not had any direct feedback or anything. I'm assuming that might be the case, and people will be up to speed and be able to manage it well if they're already sort of registered. But it was just in case there was any other points, even from yourself. But happy to get a chat anytime. Thanks, Thomas.
Thanks for the question, Alan, because it is interesting in terms of just we don't want to prohibit that engagement with all sectors. Thank you for that this morning, Thomas. No other questions, so we're just noting that report and the work that's been done. Thank you. That takes us on to item 13, and with all Audit Scotland reports that are relevant to us, they've come through this committee. But we've got Anne with us this morning. Anne will have read the report, so we don't need you to present it to us. But if you want to just draw any key messages, and then we can move to questions if there are any. So welcome, Anne. Thank you for joining us.
Thank you very much for inviting me along this morning to the committee. I suppose just in terms of kind of highlight the kind of Audit Scotland report in the terms of the kind of GMS 2018 contract, kind of highlights us that kind of reaffirms the kind of contribution of general practice in terms of improving kind of population health, but it kind of highlights just in terms of the uncertainty around the strategic direction in terms of kind of general practice. So there's kind of strong recommendations being made largely to Scottish Government in relation to the kind of contract in terms of revising the kind of strategic kind of vision and what that means in terms of kind of general practice, and it kind of highlights the need for that kind of refresh to be done by the kind of end of the kind of calendar year, with the importance in terms of, I suppose, kind of more locally through kind of IGIBs around that commitment to communication to support our communities to understand the changes that are taking place within kind of general practice, but also the need for kind of further kind of scrutiny and kind of processes in terms of evaluating the kind of services that are provided by kind of general practice. I think just the other thing, because I know that there's going to be an update at your next IGIB, is I think for us it aligns well with the kind of priorities and the approach that we're taking in terms of the kind of NHS GGNC primary care strategy, and we need to kind of focus our efforts where we can make kind of biggest impact. So I'm kind of happy to take any questions this morning.
Thank you, Anne. I wonder, Karen, is there anything in terms of specifically Renfrewshire that you'd want to bring out in terms of this? I know there is an update going to IGB, and we certainly have updates coming through the Health Board. A lot of the actions are beyond our specific boundaries, but it's important that we do take action locally.
Yeah, I think the findings from the report were well known to primary care and out of hours. I think there's no surprises within the report. I think it reinforces that national vision for the service. I suppose in GGNC in particular, with the work that we are doing around interface and absolutely how our GPs need to be front and centre in terms of that work. I think there's an importance not only from a national vision but locally for us to coalesce around that interface work, that transformational work. But if there's direction from Scottish Government around that, I think that will be helpful and only strengthen that local approach. But you're absolutely right, Max. We're taking a report through our IJB really just to highlight some of the work that's been done, the positive work that's been done, but also some of the challenges. In fact, the meeting that I'm having to leave to go to just now really is just around with Jan and her GGC colleagues, just starting that conversation about some of the issues and some of the concerns that are coming through primary care and our GPs.
Thanks, Karen. I know you need to scoot off soon. Bring Paul in next. Thanks, Paul.
Just a comment following on Karen's last point. I noticed I was at a meeting with the Cabinet Secretary was talking last week, and he, under these new reform documents, they recommitted their commitment to general practice and ongoing talks. But as ever, the devil will be in the detail.
Yeah, I think that I think there's quite a lot of and how does that work in practice and in general practice in this instance. I think that would be fair. Don't see any other questions or comments. Thanks for coming along. And these reports they're usually quite accessible and quite readable, and do give people a general update in terms of what's happening. I don't think there's any real surprises in the Audit Scotland report in terms of the way it's described, but it does give a one place to get up to speed and everything, which is helpful. Thanks, Anne.
Thank you.
And we've got a second report from Audit Scotland, which is the local government budget. So Sarah, I don't know how you want to give us some positives out of this one.
I'm not sure I can, to be honest. I mean, it's very similar to the last one. I think there's no surprises in this report. I think everyone's more than familiar. It is about the local government side of the house, and the position is very similar to the report that Audit Scotland did last year in 24. But I think one of the interesting things, if I can say that, is in section 4.7, it teases it out in the report because it does highlight the financial pressures and risks by IJBs, and they're now starting to have an impact on our partner bodies, and they are very, very cognizant of the potential impact to those if we don't deliver our savings, etc. So I think it's really helpful that that's brought out and highlighted, because up till now it hasn't featured as strongly as it has been, and it is part of the ongoing discussions that we have with Scottish Government at various different fora. So I think that's the only thing I would draw out of the report. The rest is pretty much as you would expect. The local government side is not in a great place, similar to health and social care as well. So happy to take any questions.
Thanks, Sarah. Jacqueline, come straight to you.
Thank you. Yeah, Sarah, no questions. I just wanted to say it's quite a good myth-busting document, because I think, the fact that we've got a 6% increase in real terms, leads some people to believe that we should be able to cope. But obviously, the report shows that the demands on the other side of that mean that, we still can't manage. We've got, particularly national insurance contributions was something that we weren't expecting, but just general pressures like inflation and increased demand. So I think the report is really useful for us in terms of local government. And as you say, it's absolutely, it states that the IJBs are in, financial challenges at the moment. So yeah, good report to have in our back pocket.
Thanks, Jacqueline. Yeah, it's helpful just to draw out the specifics. And I think this applies generally across public services at the moment. I think a lot of the public struggle to understand why, when taxes are going up, when the budgets appear to be going up, but it's that level of demand that we see that across all of our services. The demand, and in some specialties in particular, is really, really increasing. So we need to respond to that. And I think that is why all the reform activity is important, because we can't just keep doing more of the same. It doesn't work it's not going to work, and that's why we're having to make all these decisions at the moment across health and social care. So it's a good background document, so good reading for everyone. So we're just noting that report. That takes us on to our last main item, which is item 15. So this is this is a new thing for us in terms of formally reporting this committee's activity. It was just part of all the work that we've been doing around improving our governance structures and those sources of assurance. So the work that this committee does feed into the overall IGB assurance work. The team helpfully prepared this, although it's in my name. I think hopefully everyone recognises this, the work that's been done during the year. So we're just seeking approval that everyone's content that that reflects the work of this committee during the year. Happy to take any questions on it. No questions, that's helpful because it should reflect everything that we've been doing and just a formal overview of it. So we are approving that document this morning. Thank you for that. Which leaves us to the last item, which is just to confirm the date of the next meeting. So 12th of September, and I was just checking my diary. So I think that is my last one as chair of this. So you still get me for chair as another meeting, I think, unless anyone corrects me. So thank you everyone for all the papers this morning. Oh, Sarah, do you want to jump in?
Yes, it was just to say that we've checked the governance statement that's in the accounts that's being issued. It does reflect all of the changes, so it's a timing issue, I'm afraid, with the what came to the agenda today, but they're absolutely reflected in the one that's going forward to the IGB next week. So I just wanted to let everybody know that. Oh, super. Thanks, Sarah. It's quite an important turnaround for everyone for the accounts because they do get published at the end of June or as close to the end of June as possible. So thank you for that. So thanks everyone for your input this morning. Thanks for all the questions. Thanks to all the presenters and all the work that goes into the papers. We've gone through a lot of business there. So thank you all very much and hope you enjoy a bit of sun once work's finished this evening.
Thanks, Max.
Thanks,
Thank you.
Max.
Bye.
Thank you.